Welcome back to the topic wound healing. As I told, the inflammation and healing goes hand in hand. We should also understand how the wound healing will take place. So, not only the cutaneous wound healing, we should also learn about fracture healing, how the healing will take place and what are the factors that will influence the wound healing process as well as fracture healing process. What are the complications of this healing process? Repair begins early in the inflammation. So, whenever there is an inflammation, simultaneously the repair also begins at the same time. Hallmark of healing is proliferation of the fibroblasts. So, whenever you use the word scar formation, it's nothing but lay down of the collagen fibers mainly by the fibroblast. Fibroblasts are the one which will get activated by macrophages and they will synthesize the collagen bundles. In this process, there is also formation of new blood vessels, what we call it as angiogenesis. That is formation of a new blood vessels. New blood vessels that are formed are not very stable. They are very fragile. That's why they are easily, once you touch it, they easily leak outside and they bleeds a lot. So whenever you touch a granulation tissue, it bleeds a lot. Remember, the words granulation tissue is entirely different from granulomatous condition or granulomatous inflammation. Don't confuse for these two words. Granulation tissue, it appears as a soft, granular, beefy red in appearance. It's all because of the fragile blood vessels that are there underneath. So the newly formed blood vessels are very, very leaky. The basement membrane will not be so intact. Once you touch, they start bleeding. And the new blood vessels, that's a granulation tissue, is always edematous due to the passage of the fluids as well as the proteins and the RBCs. So have a look at the microscopic appearance of the granulation tissue. These are newly formed blood vessels. They are very, very leaky. That's why you can see extravasated RBCs. Extravasated RBCs are here. So these are the newly formed blood vessels. There is a dense inflammatory cell response. There is an inflammatory response and there is a edema. Edema appears as eosinophilic granular appearance like this. So this is edematous fluid around these newly formed blood vessels. So these are newly formed blood vessels. You see that extravasated RBCs within the outside the blood vessels. So this is a blood vessel, inside blood vessel there are RBCs, outside the blood vessel also there are RBCs, and these are the inflammatory cells mainly composed of macrophages, the lymphocytes and even neutrophils. So this is higher magnification of the granulation tissue. That is the one which will confuse you for the hemangiomas. Hemangioma is nothing but error in the formation of a tissue or hamartoma. Here also you will see blood vessels, but there is no inflammatory response around these blood vessels. These blood vessels are capillary sized and they are well formed and lined by plump endothelial cells, and they are not fragile vessels. So this is how the granulation tissue has to be differ from capillary hemangiomas. What is the angiogenesis? Angiogenesis is nothing but the formation of new blood vessels. So there are so many theories put forth how this angiogenesis actually takes place. So some suggest that it could be due to the proteolytic degradation of the basement membrane of the parent vessel. So the parent vessel will give rise to sprouting of the new blood vessels, and there will be a migration of the endothelial cells towards the site of stimulus. And some will tell that this could be due to the proliferation of the endothelial cells from the bone marrow precursor cells, endothelial precursor cells from the bone marrow. Or it could be also due to the recruitment of the peri-endothelial cells. So there are so many hypotheses that have been put forth regarding the formation of new blood vessels. Various factors will influence the formation, maintenance and remodeling of the granulation tissue. So mainly the growth factors and receptors like vascular endothelial growth factor, fibrogenic growth factors and angiopoietin. These are the three important growth factors that will influence the formation of the new blood vessels. Fibroblast or platelet derived growth factor is the one which again lay down the collagen fibers by activation of the fibroblast. Various extracellular matrix proteins, they also play important role in formation and maintenance of the angiogenesis factors like integrins, matriciellar proteins and even proteases. The extracellular matrix deposition is secreted, it is locally secreted and assembled, gets assembled as the time advances. It is important for water as well as the mineral storage. This is the one which will give rigidity for the tissues that are formed, and extracellular matrix also act as a reservoir of the growth factors. This extracellular matrix is important for cell-to-cell interaction as well as the cell-to-matrix interaction. It also helps in the cell adhesion, migration and proliferation. The extracellular matrix that is formed also is important for cell adhesions, migration of the variety of inflammatory cells as well as proliferation of the fibrogenic growth factors. Synthesis and degradation process is seen in healing as well as in the tumor growth as well as even in the metastasis. Let us understand how the cutaneous wounds will heal. There are two types of cutaneous wound healing: healing by first intention and healing by second intention. Whenever a surgeon takes a surgical incision, so they are very sharp and a lot of precaution has taken place and there is no inflammatory, not much of infection at that particular area, and this is a clean surgical wound. Such a wounds will have a limited amount of angiogenesis. So there will be a limited amount of new blood vessel formation. So new blood vessels are formed and you will see minimum amount of scar that is formed. So this is wound healing by first intention. That is classical example is the surgical incisions. Whereas what will happen with the wounds that are due to the road traffic accidents? There will be a huge amount of gap between the two epithelial surfaces, and most of the time these wounds are contaminated. These wounds are contaminated. So invariably there will be a huge amount of granulation tissue formation. Granulation tissue formation, angiogenesis will be in a huge amount. Ultimately it will be replaced by a big amount of scar. So entire thing will be healed with the scar. So this is cutaneous wound healing by second intention. So this is what happens with the accident wounds. So this is the difference between cutaneous wound healing by first intention and cutaneous wound healing by second intention. Most of the wounds will heal efficiently and the end product may not be perfect. Epidermal appendages. Remember, once the appendages like hair follicles, sebaceous glands and sweat glands, if they get damaged, they usually do not regenerate. Superficial wounds, the epithelium is reconstructed without a much of scar, whereas fetal cutaneous wounds heal without much scar formation. This particular entire process of cutaneous wound healing is divided into 4 phases. The phase of inflammation, that is followed by a phase of granulation tissue formation, that is followed by epithelial cell proliferation, and finally a wound contraction with a deposition of the extracellular matrix deposition and remodeling of the scar that is formed. So remember, 2 types of cutaneous wound healing by first intention and healing by second intention, and that is the difference. So amount of scar that is formed with the cutaneous wound healing by first intention will be very much minimal as compared to the wound healing by secondary intention. The wound, once it is there, the amount of strength at the end of first week, it will be almost only around 10%. At the end of 3rd month only, the strength goes up to almost 70 to 80%. So at least 3 months, bed rest they will advise whenever there is a big amount of wound has been taken place. Excess amount of collagen synthesis will take place from the 2nd month onwards. Various factors will influence this wound healing process, systemic factors as well as the local factors. Systemic factors like nutritional status of a particular individual, metabolic status like person if he is having a diabetes, such a person they will have a delayed wound healing process, and patients who are on corticosteroid treatment, they also will have a delayed wound healing process. Circulatory status like patient having a hypertension, they also will have problems with the cutaneous wound healing process. Local factors like presence of a local infection, various mechanical factors, presence of any foreign body that again hampers the wound healing process. The size of a wound is also important. The location, if it is located nearer to the joint where the mobility and the restriction of movements cannot be done. So again that will hamper the wound healing process, and the type of wound, whether it is a wound that's a surgical knife wound or whether it is a road traffic wound. So all these factors, various other factors also influence the wound healing process. Let us see the complications of wound healing process. If there is a deficient scar formation, it results in the wound dehiscence. There can be a huge amount of ulceration. Sometimes there can be totally no healing of these ulcers. Non-healing ulcers are the one which are predisposing factors for the development of even cutaneous malignancies like squamous cell carcinoma. Even excessive amount of scar formation is also problematic. When we call excessive formation or a profound flesh formation, we call it as keloid. Keloids are very common in the black population, and such a keloid can be even cosmetically problematic. Contractures can also happen, especially if the wounds are near the joint cavities. Similarly, the fracture also will heal with the formation of a granulation tissue that is followed by deposition of a dense amount of inflammatory process. Hematoma will be formed initially that should not be disturbed. Such hematoma will be totally get converted by deposition of the bone matrix by the osteoblast that will be replaced by osteoclast, which will remodel the particular fracture site. So there are various types of fractures as such: oblique fractures, compound fractures, linear fractures. And these are the complications of fracture healing process. Non-union, there can be totally no union of the fracture ends. Malunion, delayed union, false joint formation or a pseudoarthrosis. Sometimes joint can be totally get fused, so called as joint ankylosis. Sometimes new dead bone formation that can take place, that is involucrum, can be takes place. Very commonly we see osteomyelitis, that is wounds will get infected and there will be a formation of osteomyelitis. Remember, tissue renewal and regeneration is not equally seen in all parts of the body. Let us have a look on tissue renewal, tissue regeneration and repair. Remember, all the cells in the body have a different capacity to regenerate. It is all because we have a cell cycle that you need to understand. We have 4 phases: G1, S phase, then G2 phase and M phase. In between G1 and S, we have a one break point, and we have again G2 and M, we have a second break point. So in the G1 phase, all the raw material that is required for synthesis of DNA that will get accumulate. Once there is a synthesis of DNA, it is a point of no return. Cells will not revert back to normal stage. In the G2 phase, the cells themselves get ready for further mitosis, and after mitosis, the cells will divide by cytokinesis. One cell will become 2 cells. Most of the cells in the body, there are 3 types of different types of cells in the body. Like for example, quiescent cells are stable cells that are there in the liver. They are the ones which are said to be at the G0 phase. They are capable of entering into the G1 phase. So the liver cells, if you cut half portion of a liver, it can regenerate because that is having stem cells, so called as stem cells by the side of bile duct epithelial cells. So the cells can regenerate, and the liver, the cut portion of a liver can regenerate. So they are called as quiescent cells or stable cells. We have another type of cells which are continuously dividing cells. They are called as labile cells that are seen in the GIT and skin, where at every 4th day there will be a new layer of GIT epithelium, and every 28 days we have a new layer of a skin. These cells are continuously dividing. That's why malignancies are very common in these 2 sides, GI as well as skin, because these cells are continuously dividing. At any step, anything wrong if it goes in this particular cells cycle, mainly due to if there is any error in the checkpoints, then the cells will migrate with the mutations, and they are very much prone for development of the malignancies. We have one more type of cells in our body. They are called as permanent cells. For example, cells of CNS and CVS. These cardiac myocytes will not regenerate because they are permanent cells. So any damage to these 2 sites, it is not reversible. It is a permanent damage. So understanding this particular cell cycle is most important to understand the regenerative medicine. That's a new branch that is coming up. So remember, we have a stem cells. The stem cells are the one which are capable of dividing into any type of cell, whatever you want, provided you supply the growth factors that are required for cultivation of these cells. So once you provide the growth factors and the particular media for the culture, you can cultivate the stem cells into any cell type, whatever you want. So this is stem cell research which is there, and it is a dream in the future that regenerative medicine will become more and more popular. With that regenerative medicine applications, we can replace the cardiac myocytes which have been died in a patient with a myocardial infarction to cure the heart disorders. We can cure diabetes by regenerating islet cells. So beta cells can be regenerated. We can also cure the Parkinson's disease by regenerating neural cells. We can cure the cancer patients. The myeloblast and lymphoblast can be removed by generation of the normal blasts. We can cure the osteoporosis by regenerating chondrocytes. We can cure the burns as well as the burn scars by regenerating the keratinocytes. So this is a new branch with a lot of hopes and hypes that is coming up. That is a regenerative medicine where there is a permanent repair of failing organs can be done. So this is a future dream. Hope it will come true very early. With that, we will have an end of this particular session.